I had three wishes. I would have one that involves a magical piece, which would be just to get rid of all the illegal substances that cause so much harm. There are a lot of great things in our mental health and addiction system. So don't be scared, be brave, come in and see what it's like. My name is Leslie Buckley, and I'm a psychiatrist here at CAMH, and I'm the chief of the addictions division, and addictions has always been my specialty. I remember the first thing that I wanted to be was a vet. So that was like the age of 5, because I loved dogs. We had a dog. And then my brother, he really stomped on that by telling me that people had pet tarantulas, pet snakes, and so I just diverted. And then as time went on, I became really interested in public health. So people my age might remember in the 80s or late 70s, there was this big push called Participaction. And it came from the Lalonde report. So it's a really important report that came out in the 70s saying, it was sort of the first moment that people said, you can make your health better by, hearing our messages to do more exercise and do all these things. And so I have to say it had an impact on me. We know now that that's not really the best way to make things different, because it's forgetting about all the social determinants of health. So they were telling us as individuals, you can control your health, and there was some benefits to that, but maybe they forgot that there's a lot of other things that impact health and health decisions that people make. So I knew that I was loving medicine, and I was thinking I would go the route of the medical officer of health with that public health side and family medicine until I had my psychiatry rotation. And it was just such a great experience, and I really enjoyed working with people in that way. And at the same time, I was doing a project with a child psychiatrist looking at how socioeconomic status, poverty, impacts ADHD diagnosis, and I found it fascinating. And it kind of clicked that there's a lot of public health in psychiatry, so it just really worked. And then within psychiatry, I loved my addiction rotation a lot, the most, and it really links to public health in that same way. So it's sort of like a perfect fit. The initial understanding was that people would carve their own direction for their health, and that in some ways the individual was the source and the decision maker for how their health was going to be. And after a lot more research and understanding, and through the 80s, people really clicked in to the fact that these decisions are really based on many other factors. So your health decisions, your health, stress levels. There was really great research that showed how stress levels are so much higher depending on status. And all this information came together with a lot of advocacy saying, we have to understand that people are part of a community and part of a whole and part of a system, and things like socioeconomic status, race, support from community. So many things impact health and health decisions. There are a lot of great things in our system, in our health system, in our mental health and addiction system, but there's certainly a lot of challenges. And I think the first one that jumps out at me is wait lists. So in particular, the wait list for residential treatment, or what some people would call rehab, how important and critical that can be, but how long the wait is. So waiting 3 months, 6 months. Here at CAMH, we have a great medical withdrawal service for detox. But at the end of it, we'd love to be able to just make a really nice, neat pathway for somebody to go to residential, but that's just not how it works. People have to wait, while their application gets processed and just when spaces open up. And that's one of the toughest pieces, I think, right now. So, the CAMH services, it's more like a mall than a store, because there's many different ways to enter. And those entryways are so important, right? So we really want to make them easy access. So one way would be through our RAM, which is a rapid access addiction medicine clinic. And that's open every day. And when we opened that, we thought, wow, we could be just overrun, but it works. And, so if somebody asks me that I know personally, what's the fastest way to get care, I can say, go to any RAM, come to our RAM, you walk right in, you don't have to be registered, we'll register you. So we're trying to make it as easy as possible. And from there, people can, receive different treatments. So it could be medications, could be a psych assessment. We have a multitude of groups that people can go to. We can help somebody apply to residential treatment. We might recommend a day program. Our outpatient service also has a focus on technology and gambling, and some specialized groups, like we have LGBTQ, 2S friendly group where focus on both issues, that how there could be interesting things with the combination and substances. And we have a drug treatment court that helps divert people from the criminal system. We have our emergency room. So our emergency room has really scaled up in the last few years, and people can come in and start a detox by just walking in the emerge and get some care, maybe be able to transfer to our withdrawal management unit service. So that's also very accessible. And we have an addiction consult service. So wherever you are in our hospital, might be in a different area other than addictions, we can come to you and provide some addiction care on the spot. If I had 3 wishes, I would have one that involves magic. Truly needs the magical piece, which would be just to get rid of all the illegal substances that cause so much harm. So just have them not have been invented, so they're not available. So, obviously would have to go in the past on that one. And what we actually know is that the opposite is happening, right? Like new and more scary substances are coming, and working on the front lines, you really see how much that changes absolutely everything in terms of our ability to help people feel comfortable and get the treatment that we need. So we have to keep evolving as the substances evolve. So that's my number 1 wish. My number 2 wish would be more prevention. So I think we need to talk more to people about certain areas of harm. Like, I think we could do more talking about how people can receive opioids when they don't realize they're receiving it. So taking a different substance, but there's actually opioids in there unknowingly, which is maybe 1% of the of the preparations of a substance. But still, if you do that, if you have to be using every day in a month, that really is actually a high percentage. So I would really want to get that message out there so that people knew that. And then my 3rd wish would be the treatment system. So double, or triple the rehabilitation programming. So it could also be longer and more spots, so that magically, you could, the day you wanted your spot, we could start that and maybe get you in tomorrow, get your detox set up, and get you into treatment. Because I think it really, it's really, really hard for people to think treatment would be so far away. And then the other parts of treatment would be to create more virtual treatment. So I really feel like we could do a lot more brief intervention and earlier intervention. So it's really hard. Like, let's say you're using a substance and, maybe you're thinking it's concerning, maybe people have mentioned something, but you feel like you're not quite at that level where residential is the answer. There's not a lot of options in the intermediate zone to get help with a substance. So I'd love to see like really accessible virtual programming, brief intervention, and like once a week programming, really helping people, because the skills and the tools are amazing, right? You can learn so much, but most people have to wait till rehab to get those. So we need more like programming in the middle. I guess there'd be 3 parts to my thoughts about what we could do to improve prevention. So one would be making sure that we fill all the gaps on information. So information doesn't do it all, and we all know that like education doesn't necessarily have a great track record with prevention unless there are areas that people really don't know about. So I think it's important for us to talk more about cannabis harms, alcohol harms, which we've been getting better at talking about, and how certain substances that you think you're getting may contain opioids, and how devastating that is, and how we can see even in the coroner data that there's a lot of stimulant and opioid contamination between each other. So I would do that piece of the information and education. I would do some policy changes. So here at KMH, we really, really love our policy researchers, and who tell us how important it is, on certain, levels, how even price is actually the most important lever for impacting how much substances are consumed. So lower price, more consumption. We haven't really been able to get the politicians at this point to agree with us, because they're lowering the price and also expanding the the retail density. So there's a lot more places to buy it, which is also not a great factor. So I would try to reverse some of those policy decisions. And then I would think about programming. So we know that there's some really successful programs out there, like the Icelandic model, which is also known as Planet Youth, which is a really great, inspiring program with positive results. And it's really based on helping kids have more activities, and with activities is more connection, and sometimes more self-esteem. And in Iceland, I think they also lowered the curfew, but even just the programming part and bringing people together and keeping kids busy, I think showing the results that it did would be such a great piece for all of Ontario or Canada to really take hold of, and could have great benefits. The other promising practice is something called Preventure. So it's personalized and customized, but doesn't necessarily talk about addiction. So it picks out sort of 4 risk factors that are known for substance use. And so one would be like social anxiety or anxiety, and helps people identify, what might be their own challenges. So another one is impulsivity through questions. And then there's some, sort of customized, catered information about what could be helpful for those things, which I think is just great and makes a lot of sense. And again, the evidence is bearing that it is helpful. And I know the government has invested, which is great. So it's definitely been a hard time for frontline workers. And I think the 2 biggest challenges are losses, so overdoses for people who we've connected with and treated. And then also just like seeing people go through difficult situations, whether it's like the pain of withdrawal or difficult relationships that they're in, that they just, that they seem to be struggling with and experiencing trauma from, and not being able to do anything about it. And so, sometimes we see people get better, and that's, I think, very inspiring, and that always feels good and helpful. But I think we also have to remember that even when people aren't changing, or even if people are struggling more since they've seen us, we're bearing witness, right? We're being there, and we're supporting people, and we're giving like a human touch and a really, really, big ear for listening for what they're going through. And if you've, anyone who's been through a hard time knows how important that is. So, we don't have to necessarily look at outcomes, but just remembering, that we're in this very human profession, and that we can impact people in many different ways, including some people feeling better, which is great. And it's important to share those stories with each other. So even here, sometimes if someone's been to our Emerge a few times and then they follow up, and if they're doing well, sometimes I'll write a little note to let the Emerge doc that saw them know that they're feeling better and that they appreciated the care. Just we have to lift each other up and lift our teammates up, and have a good, like we have a social committee here at KMH on our outpatient team, and they organize events and food for us, and we have to rely on each other too. So I think the message would be to hang on, to come for help earlier than you think you should. We're not that scary, right? You don't have to have decided like firmly that you want to make a change to come and see us. We're very, very open to just hearing about where someone is at, and just letting them know their options, and just being sort of like, having a caring interaction. And then if they want more, then we can provide like a lot of avenues for treatment. But, so don't be scared, be brave, come in and see what it's like. I think the other important message is, because I work in a hospital, we see this a lot, that like you may not feel hope in the moment. And, when you're in the midst of the substance, right? So if let's say it's been there every day, it's really, really hard to get outside of it and to feel like you could do it or feel like there's any hope. But, when someone comes into hospital and even gets like 5 days, even 3 days, 5 days, it's amazing how much someone's brain can sort of shift, be like, hey, maybe I can do this, right? So just because you may not feel like you could do it, it doesn't mean you can't do it. And, come in and find out what your options are and see what you think of what you hear.